So the feedback from the 7th of December was overall feedback was satisfactory, but low numbers of surveys completed. I think there's only about half a dozen really, so it just gives us a little bit of an indication. It doesn't, so we really are keen to have feedback from as many people as possible. And a little compliment for myself, which I was appreciative of, because it is quite challenging around managing the hands up in the chat function to make sure people get the benefit of all of that and can be heard. Remember, with the recording, sometimes people don't feel able to pose a question as well. So please use the chat function box if you want to pose a question and don't want to speak. If you comment about missing face-to-face meetings, again, we would also mirror that. We would love to have face-to-face meetings again. It's, we missed actually seeing everybody and having just the chats between and break times and things, and catching up with people. It's just not the same. We appreciate that, but at the current time, we really have to follow the national guidance, and obviously at the moment we're in lockdown, so we can't have face-to-face meetings. Having the slides before the meeting was very helpful and allowed you to prepare questions beforehand, which is great to hear, because it's important that we get the questions from yourselves. That's what we want to hear. This is about the discussion rather than us just talking to you and sharing information that we think you need. You've got to have the opportunity to ask the questions you need to be asked. And suggestions for the next meeting: information regarding restrictions affecting other NHS services during the pandemic, i.e. podiatry, eye screening, face-to-face appointments, GPs and hospitals, and etc. So we'll make sure we factor all those things in as we go along. I'm going to move to the next slide. The next slide on my pack is an engagement update, which starts with targeted lung health check. Is that what you can see on your screens?
Yes.
Yes, okay. So as it says on there, the online engagement took place with service users to get their feedback on logos, and it's been really helpful having that feedback and helping to choose one logo to use on future materials. Felt it was important that people owned the material coming out and felt they could relate to that material. So whilst it might seem a small thing, it's an important thing for people to feel they've been part of that discussion and able to select the branding, if you like, of what it looks like. So it's meaningful to the individuals who've been involved in that service. The information booklets were also sent out to service users and groups, and they were asked to focus on the language and photography. And again, that was about the main objective of the work, to ensure the materials are written in patient-friendly language using plain English. And where we need to, we can adapt that to make sure it's accessible to other people who can't use or read English, and we'll make sure we can get information out to as many people in the population as we possibly can who need that. And once all the feedback's been received, materials will be amended and shared with these groups as a final version, and then service users who are contacted for lung health checks, and that will make sure that the amendments we've made are meaningful and helpful, and that we demonstrate that we've listened to what people have shared and said to us to get this right. So the next slide, I think, is health inequalities. Is that the same as you've got now? Okay, the team being involved, look, the health inequality across Gateshead and Newcastle. There's been 2 meetings taking place so far, and the group being some data highlighting areas where health outcomes could be improved. And the data itself, people might think it's a bit dry, but actually it's really important to inform service delivery and make sure we target the right parts of the population, the right people who are out there who are having really difficulties in respect of health inequalities for whatever that reason might be. So the data itself is important that we get underneath that and understand the picture we see, so we can inform future commissioning and it can be targeted where we need to. And a draft plan will be drawn up by the patient public involvement team and shared with our forum members. The plan will show which community groups could be engaged to enable the CCG to hear from patient and service users, especially those who are harder to reach, to improve their access to NHS services. And we're always keen to hear of any new groups, any new areas we can work with. So if you know of any, please let one of the team know so we can include them in our discussions. The more, it's more important it is with that. And the final report for this engagement is now available on the CCG website, and the link is shown there on the slides. If you've got this on the electronic version, you can link directly there, or just go onto our website. You'll find the report there.
We sent that out on Friday as well with the agenda, Chris. So everybody should have an electronic copy of it.
Okay. And I think now on the agenda, Lindsay's going to do the myth busting on COVID-19 before I move on to some of the place-based updates. Is that right, Lindsay?
Yes, just. Oh, I can go through place-based first, but I can go through the myth busting first if you like.
I don't mind. I should just do place-based first, and we'll get.
Yeah, so I've got Newcastle up first.
Yeah, I've got that on my screen now. So it was over 18,000 cases in Newcastle since 2nd of March 2020, and a positivity rate from the testing of just over 8%, nearly 9% actually. So we can see the numbers have been increasing. We've been seeing dips and rise in numbers. The numbers currently are rising again, and this is around the mutation, the new variant of the virus that's coming out. And as of the 1st of January, the 7-day rate is 235 per 100,000. It's slightly more than that now. It just seems to be itching up a little bit more. And as of the 4th of January, you can see the rate has increased by 270 per 100,000. So we are seeing those increases happening, and we're working really hard with all of our services and the public to reinforce the messages around social distancing, using the face mask, hand hygiene, the 3 basic messages that we continue to give all of the time everywhere we go, because these are the things we have to continue doing. And surprisingly, we still see people not socially distancing out, not following the guidance, and not wearing face coverings and things. So we're on the case, and I know the police are really getting more vigilant now around if they find groups of people together not socially distancing and not wearing face coverings. It is, the past that would have stopped groups and had a chat with them, and reminded them of the requirements, but now they're more likely to give fines. It is really getting challenging. There were 16 confirmed COVID patients in critical care at Newcastle hospitals. That number varies slightly up and down, but it still is quite a significant number of people who were in the critical care units in the hospital. The numbers of patients generally in the hospital is increasing across the board. We've got more wards, which are COVID wards. In the last 7 days, there's sadly been 13 COVID-related deaths in Newcastle hospitals and 13 within care homes. We are starting to see this continuation and rise in number of deaths nationally, and we just need to be mindful of that. We've also got challenges of long COVID, so people who've had COVID, some people actually asymptomatic and didn't realise they've had COVID, has shown symptoms way past the period of time when they were infectious or had the active virus, with a feeling of lethargy, unable to get up and do things, really feeling, some chest problems and various other things happening to them as they go along. We're establishing long COVID clinics where there'll be some specialist support to people who have them, and looking to see how we can bring that on board. What we are putting in place as well, which the pulse oximetry is part of, is the virtual ward at home. We're starting to develop the virtual ward at home, and we're pulling together where we can do pulse oximetry in people's houses who need it, so they don't need to always be in hospital. We can support them with doctors and nurses going into the home to get these measurements and make informed clinical decisions. And we've developed a really sound pathway to support people like that. We've also now received a number of blood pressure monitoring equipment to use in people's homes as well. So we're getting a much broad picture of people who've either had COVID and being managed at home, need some support, or have been discharged from hospital and need further support. So that's really starting to pick up now and take place. We've got that in place in Newcastle and Gateshead. So the Gateshead update in the 7 days leading up to including the 3rd of January was 873 new cases. The average age for these cases is 39. So you can see the age range now is lower than it was previously, and we're seeing that there's more and more about the working age people, and some of this is about not maintaining social distancing in the workplace and forgetting to do that, particularly when people are in the workplace and going for a coffee or a break. They're going to restrooms and they're not staying 2 meters apart and not wearing face masks, and those kind of basic things are happening. Just a constant painting the fourth bridge, giving that message out into workplaces, and it's all workplaces we've been giving that message out to, as we see outbreaks occurring within workplaces. In the 7 days of the 5th of January, NHS Test and Trace identified 1,800 individuals as close contacts, and confirmed cases and completed tracing to advise of just over 1,700, so 97%. I think the test and trace is now coming into its own, really. We're really starting to get feedback from that, starting to be able to pick up people at an early stage and help them to be self-isolated sooner than they would have been without that in place. A few hiccups at the beginning of the service being established, but certainly making progress now. The 7-day rate of new cases in Gateshead stands at 390 per 100,000, and there is, going up really. It's shown there that the range in the local authorities in the northeast is 219. Of course, in Newcastle there, that's gone up a bit since we did the slides. In Hartlepool, 695, so just over 700. And some of these have now gone up to 1,000 per 100,000 population. So we can see the numbers are changing on a day-by-day basis. So the slide just gives an indication at a point in time. And again, in Gateshead, we're seeing about a 14% positivity rate for testing, which is higher than in Newcastle. We've definitely got a higher problem in Gateshead in terms of prevalence of COVID-19. And the number of QE inpatients is tested positive is 63, and that was on the 5th of January. The QE, though, have made great strides in the hospital around managing the COVID outbreaks and things. We've seen a reduction in the number of hospital onset cases there to none. They've had none for nearly a month now, so they've really made some good strides in getting that under control. The primary care networks in Gateshead are now delivering the vaccines, similar in Newcastle. Vaccines being delivered on a regular basis, as we know, to over 80s, to frontline staff and health and social care staff and the care home residents. So I know in Newcastle, all the care homes now have had the vaccine, have been offered the vaccine. There were some mop-up sessions this week for those who couldn't last week. And Gateshead similarly making big progress with that. And we've similarly to Newcastle, they were on the pulse oximetry pilot started in Gateshead, and that links into the virtual ward and the BP at home, those kind of things that we're trying to work through together. And plans are in development for vaccination of health and social care staff in advance of the standard operating procedure being published. Again, when the slide was written, we didn't have the standard operating procedure. We now have that. And there's been some revised guidance come from NHS England around administration of the vaccine, which has made it much easier to do. And we can get on with that. There's a number of staff from the CCG who've been supporting the vaccine delivery programme. A number of us have included in that, have been administering the vaccine and doing the roles in the vaccine clinics. There's important roles around the admin to make sure patients are registered and make sure we get the people in the right place at the right time. And I would absolutely have to say, both Newcastle and Gateshead, the primary care networks have worked exceptionally hard to ensure safe delivery of the vaccine to the population. It's really good to see what they're doing, how it's working. Okay. So that leaves any questions before I hand over to Lindsay.
There's a couple in the chat, Chris, from Alan. So Alan's asking if the trend's still upwards, which I think you've answered that it is. And how should we report? How should we report anyone refusing to wear a mask?
You can report that to the police. I suppose it would depend on the circumstances as well. One of the things which is difficult, I mean, I was in a shop the other day just to reflect on this. Didn't have a mask on, and I was a bit perturbed, and I did ask about it, and I was told she was exempt from wearing a face mask due to medical condition. It's absolutely fine, but she didn't wear a lanyard with the sunflower on, which she should have done. So we need to make sure if people are wearing masks, they are in, they're able not to wear it because of health problems, but people know now they should be wearing the lanyard for that reason. And if you're in source where you're not wearing a mask in a shop, I would say raise it at the customer services that you're concerned about, just so they could deal with it at the time. But if there's something where you're seeing groups of people not wearing masks, or where you've got some issues, I think you could raise it by ringing. I think it's 101, the number you need to ring. Just looking, somebody's got their hand up. I'm trying to see who it is. Jean, you've got your hand up. Then Alan. Are you on mute, Jean? Do you think? I think you are on mute. I can see on the screen. That's it.
I'm taking myself off mute, Chris.
Yeah,
it's Jean first.
Okay.
Right, Jean.
Okay.
Okay.
I contacted Nexus to ask them to ask their drivers to make a statement every now and then on the trains to remind people to wear masks, and they declined. They wouldn't do it. They
wouldn't do it.
They didn't want their drivers involved in things that the police should be involved in, and all I wanted was actually a reminder, but they weren't happy about that. So
I'm happy to take that. I'm happy to take that up with Nexus on your behalf. I mean, I won't say you've said it, but I'm happy to take that up with Nexus as a suggestion, because I think, you know, it's the same in supermarkets. You're doing your shopping and you are getting constant reminders over the tannoy to maintain social distancing, to use one-way systems and all of those things, and to wear face masks. I don't think it's too much to ask. I think it's quite a simple thing, particularly in a public service, to have frequent messages given over tannoys. When they've got tannoy systems to give messages over, we should be reinforcing that.
Well,
so I'm happy to pick that up.
Yeah, because I was really concerned about being on the trains and saying it rather than at the station. As a reminder. Anyway.
But they can make it an out on a train, which is not pointing the finger at any individual, but just saying, can we remind people when you're using the train service, unless you're exempt from wearing the face mask, that you're wearing the face mask at all time. And if you are exempt, you should be wearing a sunflower lanyard. Most people now would expect that. They say that in the shops, and I don't think that would be offensive or wouldn't cause any aggravation or unwarranted behaviour. Alan, you've got your hand up.
Yeah, it was just you mentioned a kind of badge, Chris, to indicate that people have some kind of a exemption or disability that makes it difficult for them to wear a mask. Or did I hear right?
Yes, you did it. The sunflower lanyard people can wear.
Oh, sunflower. Yeah, because I also noticed a badge where people have a little notice and say my disability is hidden, and it makes it difficult for me to wear a mask.
And I suppose if people haven't had access to the lanyard or can't be able to get them, they can make something themselves to put it on to make it clear. And I think that prevents the person being stopped and asked the question, are you exempt from wearing a face mask? Because I know it can be difficult to stop people and ask the question, and it can cause them, bad feeling and things, and some aggressive outbursts, I suspect, if we don't do it in a sensitive way. So I think wearing something that's obvious does help with that.
Yeah, I think that's probably the fear of people challenging people who refuse to wear masks. There's some people who have a very aggressive nature, and it's happened to me once or twice when I asked a person why they weren't wearing a mask or keeping distance, and a person got aggressive. And
I think you have to protect yourself as well, and be careful how you raise it. I know it is difficult. I've got two more hands up. I've got David, your hands up.
Yeah, just an observation that a number of businesses are. We don't go out, so we sort of see them online, as it were. They say that to come into our business, you have to wear a mask, and there are no exceptions to that. Obviously, businesses are in a position where they can choose who to admit and who not to admit. And they don't have to give a reason, but they have given a reason, and that reason is if you don't wear a mask, you can't come in.
Yeah, well, do you know what kind of businesses they are, David?
Some of them are pubs and things. You see them outside. I saw one online which said something like, if you think you've got an exception, don't waste our time. We can't establish whether you are or not. But if you can't wear a mask, it said, what are you doing out in a pandemic? So, but they can obviously, if they're a private business, they can choose who to admit. If they say we're not going to admit anybody without a face mask, then they're perfectly entitled to do so.
Yeah. I guess that's the case, but it's just difficult, isn't it? You've got to need to make sure we don't disadvantage people in the population who can't wear a face mask and need to be supported. Yeah, okay. All right, so this is Kate saying there's a centre there in the post office near where they live and have a person on the door. No, okay. That's helpful. Any further questions? Are you happy to move on to Lindsay's myth busting around COVID vaccine?
That'd be good.
Okay. Lindsay, over to yourself.
Should put yourself back on mute, Lindsay.
You can do, yeah, that might be helpful. I think there is a bit of background noise coming through. I've actually got Paul down as the next slide, but I'll just skip forward and then we'll come back to you, Paul, if that's okay. Okay then, so focusing on the vaccine today, so as part of the myth busting session. So I think rather than try and put hands up or whatever, we'll just try and do it on our own. So the vaccine was approved too quickly. It won't be safe is the first myth. Now, true or false? I think we'll probably all, they're pretty much common sense, these ones, but I think what's good is the information that you get around these. So thank you, Kate. Yeah, false. So the most vaccines take years to develop, to test and approve for public use, but a global effort has meant that scientists have been able to work at a record speed. And the most important point here is that although the vaccine was developed and tested very quickly due to the need, it still went through the same approval and testing process as other vaccines. So there hasn't been a shortcut on that part of the process, which is reassuring. Next myth is the vaccine could give you COVID-19. Is that true or false? Happy for you to pop it in the chat the way Kate did. So Kate's popped in false there. Yep, false. So some vaccines contain germs that cause the disease and they are immunizing against, but they have been killed or weakened so that we don't become poorly. But in the case of the coronavirus vaccine, none of that are in development at the moment have the live coronavirus, and they therefore cannot give you the infection. So the third one is, I don't need a vaccine if everyone around me gets it. I think in terms of getting the vaccine. So is that true or false? You're on a roll, Kate. False. Thank you. Yeah, so if obviously what we need for this vaccine to work is that we need the majority of people to become vaccinated. So some people might think they can miss out. As long as the rest of the community are immune, they'll be okay, but that's false. For the vaccine to work, we need as many people to be vaccinated, or the virus could continue to spread. So best to get your vaccine done. And the next one is just get coronavirus and then you'll be immune. Is that true or false? False. Yep. Thank you, Alan and Keith. False. So they're all false. So the risks of getting the virus and having a serious long-term complication are much higher than those of the vaccine itself. So it just makes more sense, really, doesn't it, to get the jab if we can, whenever we're all sort of programmed in to get those. And then just a few frequently asked questions now. So who can get the COVID vaccine? We did a couple of weeks ago, we did share that sort of ladder where it showed you the age breakdown, and obviously most vulnerable people are prioritised. So currently the NHS is offering the COVID-19 vaccine to most people at risk. The vaccine is being offered in some hospitals and hundreds of local vaccination centres run by GPs, which Chris mentioned. And it's being given to some people who are aged over 80, and especially where they've already got a hospital appointment the next few weeks, they're trying to do both at the same time. People who live, work in care homes, healthcare workers at risk, and you also need to be registered with a GP in England. Thank you. And the next one is, what if you're pregnant or breastfeeding? There's no evidence the COVID-19 vaccine is unsafe if you're pregnant or breastfeeding, but more evidence is needed before you can routinely be offered the vaccine. So I've got there that the Joint Committee on Vaccination and Immunisation has updated its advice to recommend that you may be able to have the vaccine if you're pregnant and at high risk of serious complications of coronavirus, and if you're breastfeeding. But what they do say is you need to speak to a healthcare professional before you can have the vaccine. And basically it'll be a personalised discussion around your background, your health, your history, and personalised to you. But what is good there is it says you do not need to avoid pregnancy after the vaccination, and the vaccine cannot give you or your baby COVID-19. How effective is the COVID-19 vaccine? So I think we're not talking about the Oxford one here. So the first dose of the COVID-19 vaccine should give you a good protection, but you do need to have the 2 doses of the vaccine to give you that longer lasting protection. There is a chance that you might still spread the coronavirus even if you have the vaccine, which means it's still really important to follow social distancing guidance, and if you can, wear something that covers your nose and your mouth in places where it's hard to stay away from people. So it's still really important to follow them guidelines, and make sure that you're doing your bit to keep everyone safe, even if you've had the vaccine, and yourself. So that's the frequently asked questions and the myth busting session. There's a few comments come through in the chat. So going back to getting COVID can protect you is a bit like refusing a seat on a lifeboat because you're a good swimmer. Yeah, definitely agree with that. I've heard there's some bureaucracy around retired health workers, GPs getting permission to give the vaccine. Is that being tackled? Do you know that one, Chris? You're on mute, Chris.
Sorry, I was trying to be really proper and going on mute when I wasn't speaking. I forgot to put it back on. But what Pat raised at the start, before we really started the meeting, there's a huge amount of work to go through, and statutory and mandatory training sessions to do, and DBS and all those kind of things. So the standard for employing volunteers is exactly the same as it is for employing a permanent salaried member of staff, and that's what's causing the issue. As I said before, it's been known as a national issue and it's been explored and looked at to be more proportionate. So we just need to wait and see what's happening. But I definitely know it's putting people off coming forward to support the vaccine programme.
And then there's one here as well from Terry. So lots of concerns coming to the patient participation groups about how can people find out when they might hear about getting vaccinated, and the messages don't ring up, isn't it? But how can people check that they haven't fallen through the cracks?
Yeah, I suppose the information is not that clear. What I will commit to doing, I'll contact our COVID hub in Newcastle and ask if they can give us a bit of a timeline around each of those, the 10 categories, so we can add that onto them and share that out.
That would be brilliant. Okay, I've got one hand up. Let's see who it is.
I'll be back in 1 second. Sorry.
Okay.
I'll be back in 1 second.
David, got your hand up. Do you want to come through with your comment or your question?
But there's a comment, a couple of comments really. One is that we've sort of heard a lot of people ask in various sort of media, can you get COVID-19 from the vaccine, which is a load of rubbish, of course. And the other comment, I suppose, is that we've noticed, I mean, you've probably all noticed, that certainly Qantas and probably Ryanair are all sort of indicating that they're not going to, well, Qantas have explicitly said You won't be able to fly unless you've had a COVID-19 vaccine and can prove it, which might well have an advantageous effect for all these anti-vaxxers, because when they want to go on the holidays, probably find they won't be allowed to travel on any international travel by boat or plane or train unless they can prove they've got a vaccine, they've got a certificate to prove it. And in that sense, they could have quite an advantageous effect to the vaccine sort of density, because that's what will concentrate people's minds at the end of the day. Can I travel or can I not? And if I can't travel, then maybe I better get a vaccine.
Yeah, I can see that. I mean, and for the younger population, because I think I've put my details in that calculator online, so I'm due to get mine. Apparently, when I checked, it was July through to September. So that means I can't go on holiday before then if I fly through those airlines.
Well, I think you'll see an increasing number of airlines and other travel agencies, like the Eurostar and the ferry companies and so on, will start saying, you need to have a vaccine certificate to travel. I'm sure that's going to be the case.
Yeah.
And other countries might insist on it to enter as well.
Mm-hmm. So, yeah, I've just mentioned that I don't know how scientific it is, mind you, but there is a calculator online, so you put your details in.
The Omni calculator.
Omni. Yeah. Omni, that's it, Omni. And so you put your personal details in, and then it tells you how many people are ahead of you in the queue and when you're likely to get it. It's a rough estimate.
I think that's helpful if people can access online arrangements, and that I didn't find it easy to follow, to be honest with you. I don't know what you thought, Lindsay. Asked quite a lot of questions, and I think I will still ask if we can put an indicative timeline on each of those stages to just give people some idea. Yeah. And I think if people don't hear within the timeline you're expecting to hear, it's not unreasonable to make contact with your practice to ask.
Mm-hmm.
The message is don't contact us, we'll contact you, definitely, because that's that's what the practice is doing. And I know we've vaccinated thousands of people already across Newcastle and Gateshead using that arrangement.
I've also got a question here from Judy in relation to David's comment, which I'm not sure you fully heard, Chris, but it was around airlines saying that you can't fly unless you've been vaccinated and you can prove it. So then Judy's asking, how can we obtain a certification of vaccination?
When you get the vaccination, you're given a card which tells you the date you had the vaccination, the batch that you had, and the vaccine that you had. So you can keep that card and give that card. It also has a space on it for the practitioner to write on the second vaccine you get. So the date of the second vaccine can also be included in that card, and that's evidence that you've had the vaccine.
David, you got your hand up. Is it from previously or? No. I think we need to hand over to Paul now.
Elizabeth got her hand up first. Sorry.
Apologies. Sorry, I didn't see that. Elizabeth?
Elizabeth, you're on mute.
Right, is that okay?
Yeah, perfect. Yeah.
I just wondered how many people here this morning had actually heard about their vaccine, or whether nobody has. I'm just curious. I heard last Thursday, our GP was given permission to contact patients. And so my husband and I are getting ours tomorrow, but I wondered whether anybody else had heard.
I don't think many had, because Chris asked at the beginning of the call and not many people had. Mm-hmm. I think you might be the only one, Elizabeth.
That's probably old age.
Yeah, at the moment, the people are being called who are over 80. I don't know how old people are, I wouldn't be that rude, but I think that's been very rigid around doing that route.
See, my father-in-law's 86 and he's got lung cancer and COPD and hasn't heard anything yet.
Mm-hmm.
So he's in Gateshead.
Yeah. Pat, you got your hand up?
I think it depends, as they're doing practice by or amalgamation of practices. I suppose it depends on how many over 80s you've got within a group of practices. And I've been told
that is an issue.
In Bladen, which my practice belongs to, they're nearly at the end of the over 80s, and maybe in the next age bracket should be hearing soon. So I think that is not an issue, but it's not dependent on where you live, but how many elderly folk is within your group of practices, possibly.
Yeah. And we should start to see more appointments being given out now that we've got the mass vaccination hubs opened from today. So we've obviously got the Centre for Life in the North East. And I suppose for our population, we're fairly lucky it's in Newcastle. There's people can be asked to go there from anywhere in the North East and North Cumbria. But they get a choice to go there or not. They can still stay and go in their own GP practice.
And then the things should move more quickly, shouldn't it, when the GPs can do the Oxford?
Yeah, it should do, yeah. It should, absolutely should, Pat.
Because they'll be given, the GPs will be given them within their own practices when they get allocated the Oxford one.
Yeah. I mean, some of the Oxford vaccine is coming in this week, but we're reserving that for use in care homes and domiciliary because you can move that one around, whereas the Pfizer vaccine can't be moved more twice once it's constituted, so you couldn't give it out in the community. So that's why in the GP practices and in the hubs, people will be getting Pfizer vaccine in the first instance rather than the AstraZeneca vaccine. David, you've got your hand up.
Yeah, I mean, just a comment about that. You know, how the way the vaccine works in a group of GP surgeries. I know in the group I'm in, and I know people who are in the group that I'm in, and they seem to be doing it alphabetically. So we've got an 80-year-old whose surname begins with A has had the vaccine, but another 80-year-old whose name begins with W has not yet been invited. So it seems to be, you know, like an alphabetical thing that they're doing.
Yeah. I know we are getting through all the over 80s in Newcastle and Gateshead quite quickly. We are in the northeast and the north, Hempstead, Dunwich, whereas in the rest of the country it's not just a few hundred. We're significantly making a big difference. Jean, your hands up.
Yeah, it's just to clarify a question I was asked, which I couldn't answer. Is if you get the Pfizer one for your first jab, does it have to be the Pfizer one for your second jab?
You'll be called back to get the same one for the second jab. That's what we're trying to do, definitely, yes.
Yeah, I thought that would be the case, but as I couldn't answer the question, I thought I'd get it from.
The vaccines work differently.
Mm-hmm. Thank you.
Okay. Should we hand over to Paul now? Is everybody okay? Everybody happy? Paul, it's over to yourself. Thank you.
All right. Hi. Can you hear me? Sorry, can you hear me?
You sound echoey, Paul.
All right. Sorry about that. If it's too bad, stop me. And about 11, I use a different computer. If that's helpful. Am I still echoing?
That sounds a bit better, Paul.
For me, Talk about the people is better. Is it better? Okay.
I'll try and sit nearer.
You're breaking
Yeah,
it.
no, it comes and goes, but we can. Yeah, it says breaking up a bit, but we'll try and keep going.
Yeah, if it's a problem, stop me, and I'll try and get the other computer at 11. Right, just I'll explain. My name's Paul Burtick. I'm a lay board member at Newcastle Gateshead CCG. I thought I'd better explain what a lay board member is. Yeah. Lay board members are recruited by the CCG.
Paul, can I interrupt? Sorry to interrupt you. We
Actually,
can't. Paul, Chris, can I interrupt you, please? We can't hear everything you're saying on here. Maybe it's every second or third word. It's not very clear.
Right, should I do my bit later when I might have access to a better computer? I think from 11:30.
Okay.
We could
Should we have our break now and come back earlier from the break?
yeah, that sounds good to me.
Come back about, what time is it now? About 10 to. We come back about 11 o'clock. And then we'll put the agenda up all the way, and Paul will put you with data after stroke association. Is that okay to give you time to get your computer sorted? Yeah. Okay. So we'll have the break now, so people can turn the cameras off and put the sound on mute. We'll come back in 10 minutes. Thank you, everybody.
Lindsay, would you like me to put my? Oh, hiya. Shall we wait until after the break?
Oh yeah, well let's we can get set up now, can't we? So I'll stop sharing.
Yeah. Oh, though you've got your message there about the break. I don't want to. Should we give it a quick go to see if I can actually take control?
Yeah, actually, hang on. I've just remembered I'm recording, so I'm going to have to start that first. Oh, no, do I? No, I don't have to stop it, do I?
No, maybe not. If you just stop sharing your screen and I'll see if I can share mine.
Yeah, of course. There we go.
Hoping my IT holds up here.
There we go. That should stop and then let you on.
Cool.
There we go.
Right. Is that showing?
It is, yes.
Grand. Hang on though. Audio. I need audio. Share content and with audio. Where's it gone? It's typical that I would. Can you see anything at the minute? Am I sharing anything?
Not at the minute, no.
Sorry. There. Is it sharing now?
It is, yes.
Awesome. I'm just going to try and play some audio quickly.
Okay.
See if you can hear it. And then I'll let you get your break as well, Lindsay. Sorry.
That's fine, don't worry. It's working.
Excellent. Thank you. Okay.
Well done.
We're good to go. Take us back to the start. Honestly, IT.
It's not often it works.
No. Thanks. Oh, it's frustrating for Paul. You couldn't be heard there. So frustrating.
Hopefully you'll be able to speak a bit later on. So
Yeah.
that would be good to hear from him.
Mm. I'll put myself on mute for a minute. I'm going to keep my camera off because just for internet.
Yeah. Okay, see you at 11 then.
Bye.
Welcome back. Is everybody back? I'll just check on the screen where it's telling me. Yeah, it looks like most people are back. Okay. Shall we start the second part of the meeting? I'm going to hand over to the Multiverse Lab presentation, please. Thank you.
Great, thank you very much. Can everyone see the presentation?
Yes.
Oh, great. Whew, I'm really nervous about all the technology and if it's going to work. So thank you very much for inviting me here today. My name's Kasia Karofska and I'm a patient and public involvement manager at 3 different National Institute of Health Research organisations that are based at Newcastle University and Newcastle Hospital Trust. So I spend my working week trying to involve members of the public and a diverse group of the public to involve them in research and to hopefully make sure that they're right at the heart of what happens in the research that we do in Newcastle and in the Northeast. I recognise quite a few names, so apologies to some of you who will have seen some of this presentation before and will know a little bit more about health research. But for those that don't, I'd love to, at some point, if you're willing, this year, come back and tell you about the breadth of research that's happening in our area. Just briefly, we've been involved this year in quite a lot of COVID-related research. So Newcastle Hospital Trust has been housed our clinical research facility, which I support at the RVI, has been helping with the trials for the vaccine. And also we have an organisation here called the MIC, which is a research group that look at health diagnostics and the tools that we use to diagnose health conditions. And they have been leading national work around making sure COVID testing is as good as possible. So there's lots of really fantastic research happening, lots of very, very clever people helping us get through COVID, but also helping on a wide range of health research to make us all healthy and fit and hopefully happy in the future. So I've come to talk to you about Multiverse Lab today. And Multiverse Lab was created last year based on an art installation that a local company called Unfolding Theatre, and they work primarily in theatre production, but they also have expertise in getting members of the public to participate in theatre activities. And Annie Rigby, who's their artistic director, in 2018, she's got a friend who works at Eton College down south. And as we all know, a lot of our prime ministers and our leaders are often from Eton College at the minute. It's just the way the world works. And her friend, who's a teacher there, said every young person gets asked what they're going to do when they're in charge. And that made her think, why aren't all young people asked what they're going to do when they're in charge? That should be a question we ask of everyone and not just our Eton College students. So she created, with disadvantaged young people from across the city and the Northeast, she created something called Multiverse Arcade, which was, as you can see from some of the pictures, was a really exciting and interactive kind of experience, an art installation, they called it. But at each of these different stages of the arcade, you would spin a wheel of fortune or put your hand in one of the future telling machines, and it would tell you something around climate change, because in 2018, plastic and Attenborough's programs really was shining a light around our climate change issues, and the young people wanted to focus that as the question of what they're going to do when they're in charge. But the magic of what they did in Multiverse Arcade was they created something really exciting and really engaging, but you're also asked at the end what you're going to do or what your priority is for climate change. Now, I saw this Multiverse Arcade in Cowgate in a children's centre in October 2019. And what I loved about it was there was young mums, you can see there was some young mum baby groups, and they were going in and enjoying it and giving their views, as well as disadvantaged young people who were there spending their half term there when they weren't going into the city. And it showed me that it was a way of getting people who wouldn't usually get to talk about issues to have a fun, engaging way to talk about them and to give us their views. So 10,000 people across the Northeast actually, over the 2 years that Multiverse Arcade was running, gave their view. And what I've done over the last year is work with Unfolding Theatre to create a version of that, which is called Multiverse Lab, which asks for the public's opinion around what is the medical research breakthrough they want to see in their lifetime, focused on research, so that we could try and talk to as many different people as possible what they want to make sure our health researchers, our very clever scientists, are focusing on in the future. So we got to the point at the start of 2020 of thinking about what that might look like. And you can see here, even at the start of January, we were even in the first months of January, we were starting to think there would need to be social distancing involved. We were taking inspiration from the Metro map around equalities and the different life expectancy ages between Ponteland and Byker and other areas. And we were thinking about how we would have different voices and people playing, and people could hear other people's priorities and inspire them to think of what their health priority would be. And we had this idea of that little yellow booth where people could go in and have their own private moment to talk about what matters to them in terms of health research. And then COVID hit properly and we couldn't do that. But what we really thought the idea was unique, and we really wanted to push forward with it. So we decided to create a digital version of it with the hope that we would be able to create something like this physical version at a future point. So to do a digital, the other reason it was fantastic actually to switch the project to a digital version is right in the early days, when after I saw that Multiverse Arcade version in Cowgate, I went to different public representative groups, Voice, who are a digital public group based at Newcastle University, but has hundreds, and I'm sure there will be members of Voice here as well, hundreds of thousands of members all over the country now. And I also went to Apex, which is the patient group based at the Newcastle Hospital Trust, who get involved in the hospitals delivering their services. And I asked them, is this a good idea? Should we invest in it? Is it a good idea? And everyone said yes, but they wanted a digital version as well for the people that wouldn't get to see the physical version. So we thought, well, great, we'll just switch the project to be digital for now. So here's just some summaries of some of the elements that went into creating it. So at the top there, I've talked about co-production. That's basically that we have involved people, some fantastic public representatives right from the start, asking them first, should we do it in the first place? And then in the very early days before we had the national lockdown, we did manage to host one or two creative sessions where we brought people together and asked them, and they helped inspire the idea and the question that Multiverse Lab would focus on. There are many, many partners involved in the project and are funding the project, and I've listed them all down the side there, but they are the NIHR is the National Institute of Health Research. So this is the funding research arm of the NHS and the government's main focus for a lot of the health research. So all the local based ones have been supportive of it. The focus is on trying to talk to people who we haven't usually talked to about health research, who didn't know about health research. Now, COVID has helped. People have heard more about scientists and health research this year, I think, than any other year. So it has been a little bit easier to talk to people, and it's not such a alien concept, health research, to people. People know a little bit more about it. And to create the digital version, we wanted to try and be quite innovative, and we've tried to use a gaming platform rather than a normal website to create it, so it would feel like something you went into rather than just a standard website that you would go to. And with the help of the public, we focus the question, which is, what is the health research breakthrough you hope to see in your lifetime? So the main outcomes for this project is to try and help get as many members of the public to respond to and to put their voice in, so that we get an idea of health research priorities, and they will help inform research that is happening in the future. We wanted to try and just let more people know about the wide range of research that is happening, and some of the fantastic research discoveries, health research discoveries that have happened right on our doorsteps as well. We hoped it would, hopefully, we hoped about 5% of the people that get involved will want to come and get more, want to do more than just add their voice, and actually come and get involved in the wider health research activity that we do. And we hoped we'd reach some new people who hadn't previously talked about health research. So I'm going to take you on a very, and you've seen this from the copy of the slides that we sent through, but I'm going to do a very quick tour of what the Multiverse Lab is. So we've got 4 different people that will speak to you when you enter the website, enter the gaming platform. And we've got EJ, who's a British Sign Language, so she uses sign language to communicate. We've got Kay, who's a young Geordie rapper who I'd never heard of, but is very, very popular with young people. So Kay was very helpful in being one of our hosts. There's Tony, who's a Geordie guy, lovely Geordie guy, and Umar, who speaks in Urdu and English to try and think about diversity in the language that we use. So these are our first 4 presenters, our first 4 stewards, and they do a lovely kind of 3-minute speech to you, a little recording, and they tell you about why it's important to be part of research, and hopefully inspire you to want to have a look beyond their faces. And then this is the main website page, and the 4 different icons that you can see are the different parts of the Multiverse Lab. This one I'm going to show you is look how far we've come, and this is a test tube timeline through the decades up until this decade of what some of the biggest health breakthroughs have been. To get into this section, you can add the year of your date of birth, and it will take you directly to the decade that you were born in, if that's a particular interest, or you can skip that and just look at the timeline yourself. The reason for wanting to ask people the year they were born is trying to capture a little bit of high level information about who is actually visiting the website. Sorry, I keep saying website, the platform. Then there's a map of now, which at the minute is the north of Tyne area. Yeah, on there you can put your postcode in, or the first part of your postcode, and it'll take you to your area, and it'll either tell you about a discovery from a scientist who lives local to you, or it might tell you about a study and some findings, or it might tell you about some of the health inequality sort of data that we know about. Like, for instance, I think if you type in a Gosforth postcode, it'll talk about air pollution and the issues around air pollution. So the idea is to get people to start thinking about health and what matters to them by looking at this map. This is one of the pages which is just a library of everyone's recorded priority. So you can click on these and hear what other people have said. So if you remember right at the start, we had that physical version that we were going to create. We had little cones with speakers. This is really trying to create it in the digital version where you can hear what other people have said, which may or may not spark something in you about what you would like to say. And then the final page you get to is adding your voice, and we've tried to make this as simple as possible. Again, like at the start, you had a little recording. Your steward, whoever you picked, will then once again give you a little message and encouragement to add your voice. And yeah, or you can also, if you don't want to use and it's very clever, I don't know all the technology around this, but basically when you click on this to add your voice and record, it will the system asks you for permission for your if you've got a voice recorder, an audio functionality, it'll ask for permission to be able to do it. But you can also write in the box what you would like to say instead. So to end, I wanted to tell you a little bit. So we launched this in October, and I want to tell you a little bit about what we've found so far and who's responded so far. This information is slightly outdated because it's from an event that we held at the start of December. So I know there will be more members of the public that have completed it, but this information is from the start of December. So at the start of December, we'd had 165 members of the public contribute, and that's 8% of the way to our total target. We hope to capture 2,000 voices by the end of this summer, all being well. And now I'm hoping this audio is going to work and you're going to be able to hear some of the voices that I've already added. So what have we heard so far? This is a long list of all the different priorities that people have talked about. But I'm going to just highlight to you 3 of the main top priorities that are coming through so far. And then hopefully I'll be able to tell you one around equality and access, which is an overall kind of theme that's coming out, which we feel is very important to highlight. So I'm going to try and press play and hope you can all hear this. You might need to adjust the volume on your computers or your laptops, but let's give it a go.
I think mental health is the pandemic has shown us increasingly how important that is, particularly in the northeast, where male suicide is I think the highest in the country.
Change I would like to see is a blue light mental health ambulance support system for people in crisis.
I would hope there would be more of a focus on children and young people's mental health, because I don't think I appreciate the changes that have happened certainly in the last 10 years with social media and things like that, and what impact that's had on people's, particularly children and young people's mental health.
Okay. So I've not heard any pings or anything like that, so I'm hoping everyone heard that and saw that. So as it says, the third most talked about issue was mental health. The second most talked about issue, if I move slides, that's starting that one again. Let me click through. Great, press play. So the second most talked about issue was
the main one would be cancer, because that is the main taker of life at this point in time.
I would like to see a breakthrough for cancer, but of course cancer is a very broad church. Different kinds have different treatments now. So I think the recognition of cancer and a treatment for each kind of cancer would be absolutely marvelous, but I don't think I'm going to live long enough to see that. That would be nice.
The medical breakthrough that I would like to see in my lifetime is a cure for all cancers.
Okay. So yeah, cancer. I was expecting cancer to be the top one, but it wasn't. So the most talked about issue so far on Multiverse Lab is
scientific breakthrough I would like to see is a cure for neurodegenerative diseases. I guess if I had to pick one in particular, it would be dementia.
I would like to see Alzheimer's disease cured within my lifetime, just from the destruction it causes families and the upset.
Cancer would normally be the default option for most people, in my opinion. Mine would be dementia. I've got an elderly grandparent who was diagnosed with dementia a couple of years ago, and she's just been declining on a sometimes weekly basis. And it's difficult to see someone forget your name and forget your place.
Okay. So those are the top 3 currently that people are saying are their priorities for health research. But there was, sorry, just let that run out. There was.
The main one would be cancer, because that is the main taker of life at this point in time.
Doing so well.
I would like to see a breakthrough for cancer, but of course, cancer is a very broad church. Different kinds have different treatments now.
Okay, I'm going to just play this one before there's any more technical issues. So this was an overall issue that people were raising.
I would like to see a social change between medical practitioners and patients of colour, because a lot of patients of colour either get dismissed, or there's still archaic notions of a lot of people have, like black people having a higher pain tolerance, which is totally untrue. And I'd like to never have to hear of like my mum or a friend having to go to the doctors and have to up what their symptoms are just to get considered. And I'd also like to see the fatality rate of black women in childbirth go down.
One of the challenges of living in a rural area, as we do in Northumberland, is actually access to healthcare and social care, and the impact of isolation with living in a rural community.
The breakthrough that I'd like to see is the fact that we just accept that men die on average earlier than women.
Okay. So yeah, some information about the distribution of people, because we've asked for ages. So actually, there's quite the majority of people who've responded are between the age of 30 and probably up to 50, which is interesting. We'll be interested to see how that changes as we get more people responding. And just looking at the average age distribution between the issues. So for dementia, people were tended to be slightly older age. Well, not older, I wouldn't say 48 is older, whatever, age is just a number, but they're into kind of they're not the kind of 18-year-olds thinking about dementia, cancer, and then in reflection of that, mental health seems to be something that for younger age groups responding seems to be more of a priority. So final slide is what's next for Multiverse Lab. So we've got 165, hopefully more, voices added. Our plan this year is to develop and maintain the digital site and to hopefully make it, at the minute it's just of the north of Tyne map, we want to make it the whole of the northeast. So to include Gateshead, who currently aren't on there. We want to spread the word and ask as many people to add their voice as possible, and that's a bit of a request today. If anyone's interested, we can, Unfolding Theatre can actually organise a session over Zoom or Teams and actually talk to you about it and take you through it, and kind of guide you through it as well. We can do that for groups or individuals, so please do let us know if anyone's interested in one of those sessions. We're going to be collating more of the information and then thinking about how we use it in future health research, but we are also interested how it could be useful to the CCG and to the trusts and others for health service delivery, particularly around those messages coming around equality, and how it needs to be important that everyone has equal access and feels that they don't have any barriers. And we are hoping that in summer next year we can have a face-to-face version of this and create that face-to-face version, COVID safe of course, but we are putting together a plan to be able to do that within our communities locally as well, for people who can't access the internet at the minute. So that's it. I'm gonna stop sharing, if that's okay. hope that's been useful. I'm happy to answer any questions, conscious of time. But I'll maybe give Lindsay my contact details as well if anyone wants to follow up with me after and to share it and get involved. Be very happy to hear from you.
Yeah. Are there any questions? And what I would say is, if you are interested in getting involved, please let Lindsay and the team know, and we'll pass on your information to make sure you can be contacted. Makes it easy if you just contact a contact detail you're already familiar with. Any questions before we move on the agenda? Really helpful presentation from my perspective. I was very surprised to see, the order that they've been coming out as priorities. Although clearly, I think dementia is a big issue for many people these days.
Yeah, and I think the priorities may change as we go to different community groups as well. So we'll be interested to see how those priorities change over the next year.
Yeah.
And one thing I will say is COVID has not come up a lot. We expected many more people to say COVID, and they haven't. I think that might be because of the way the question's worded. It's about your lifetime, not just now.
Okay. No, that's really helpful. Thank you for the presentation. Really useful. I'm sure people want to follow up on that. Can we move down the agenda now? It's an update from the Stroke Association. Brenda, are you on the call?
Hi, yes, I'm here. I'll just pop the camera on. Lindsay, I don't know if you got my one. It was just one slide to have on while I'm talking, or was that not able to be shown? Just in Stroke Rebuilding Lives? No? Can you hear me? Hello? Hello?
Lindsay, have you got the slide?
Lindsay? No, I'll just start. Shall I just start? Yeah. So I short. Can you hear me?
Yes.
Can't.
Right. Right.
Yes.
Right. Well,
I can hear you. Yes.
You can hear us, right? Well, for those who may not know me, I'm Brenda Walker. I'm Stroke Support Manager for the North East and Yorkshire. I cover Gateshead, Sunderland, South Tyneside, North Cumbria and North Lincolnshire. But today I was just wanting to give you an update on what's been happening with the Stroke Association. In 2019, we published a new corporate strategy, and this was developed in collaboration with staff, volunteers and stroke survivors. So to build on this, we've created a new operating model, and it means that we're moving into a different structure and we're adopting our ways of working to a more effectively more deliver our strategy. And we're doing this by embedding a more forward-thinking, integrated and inclusive culture. But like many charities, COVID has had a big effect on us, and we're now in a position where we've got to speed up our plans to help, because financially COVID's had a big impact on us. So in order to be able to fulfil our promise to rebuild lives after stroke, one of the things we've done to help with the fundraising is to make all our staff remote workers as of October. So we now don't have any local offices at all. We are all working from home, but we will eventually have hubs that we can go to for meetings. So I'll tell you what's happening in Gateshead. That's probably obviously more of interest to you. In Gateshead, we have a stroke recovery service, and they provide a coordinated support to individuals throughout their stroke journey. It begins as soon as we know someone's had a stroke. So usually we get in touch with the hospitals. Staff would normally visit the ward, but obviously at the moment we can't do that. At the minute, we're doing everything digitally. So we're having emails, secure emails. We've got NHS email accounts where we get the referrals through. So staff can then get in touch with anyone who's had a stroke, their carers and their family. So the initial contact starts in the hospital. We help to support with discharge planning and the risk of readmission. And then following discharge, we carry out a holistic assessment on the person, which would normally be done face to face. At the minute, these are getting carried out digitally, and they have been working very well. But since December, what we've done is, for anyone who isn't digitally connected, or for anybody who needs that face to face, we are now offering a home visit. But our staff do wear PPE. We have a strict risk assessment that the staff do before they can go out, and a triage regime that we follow, so that we're not putting anyone at danger, staff or the people that we're visiting. And it's very much on a, very much if that's the only way we can support that person. So we've started that again since December. So in the long term, we'll have regular reviews of people, and support remains appropriate to each person for stroke survivors and their carers, and we can put them on and access a wider long-term help. We have self-management groups, and we have self-management tools. Again, at the moment, we haven't got face-to-face groups, but we've been doing them via Zoom. And what we've found is that we've had a really good intake, and a lot of people have said that they wouldn't have come to an actual group because they would have found travelling difficult, and sometimes the cost of travelling, but they quite like the Zoom groups. So I think that's just about everything I was wanting to tell you. We do have our staff have now been made key workers, in as much as they can have a letter to say why they're travelling. We're working with the CCGs about vaccines, but obviously we're not an immediate need because we are doing very few home visits at the moment, but it is something that we're asking the CCGs about. And the only other thing I wanted to tell you about today really was that we have a Stroke Prevention Day on the 14th of January. And the idea is that you make a pledge to make one small change that would help reduce your risk of stroke. So an example would be, looking at your relationship with alcohol, increasing your fruit and veg intake, anything like that. And you can pledge from the 1st to the 31st of January for a 3-month period, and it's hoped that by the end of a 3-month period it would have become a habit. Everything is on our website and on Facebook, but if you wanted to share posts, you can use hashtag Stroke Prevention Day and hashtag One Small Change, and just go on my webpage and pledge, and then there's a dedicated team who can help as well, and they'll be giving lots of hints and tips to help with that. And it's been sponsored by Omron, who do all the BP machines, and Low Salt, and the Rotary are involved as well. So is there anything anyone, I know I've rushed through that quite a bit, is there anything anyone would like to ask about local services? We don't have access any services in Newcastle, unfortunately. It is down to funding, but we do, any patient who goes into the RVI who is from Gateshead, we do get their information from the community stroke team, and we do still visit them or get in touch with them at the moment.
That's been really helpful, Brenda. Are there any questions before we move down the agenda? Anybody got any questions, or you're all happy? It's really useful information. Let's see how many of us can pledge to do something different to reduce our risk of stroke. Sounds a good strategy to have. I think Paul's rejoined the meeting on a different computer, so let's see how we get on. Paul, I'm going to hand over to yourself now.
Oh, great. Thank you. Can people hear me much better now?
Yes, that's much better. Thank you.
Much better, yeah. Much.
That's good then. Thank you. Sorry, I just thought I'd better explain first what a lay board member is. There's 6 of us in Newcastle and Gateshead, more than most CGs. The CCG
has lane members there. Most people have described it as being a critical friend to the CCG. All the big board meetings and the big committees from the board can only be quorate if they've got a lay member on them. So it shows how important the role is in that sense. It is mainly a high-level role. It's high-level information that we normally see, and we don't often get involved in great amount of detail on things. I personally sit on the board, but then I sit in the quality and risk meeting, and that sees all the information that comes in from all the different foundation trusts, community trusts, etc. From all the meetings that we have with them, and they all come into the quality and risk meeting, which oversees all of that. And we see all the information on things like, we see information on things like serious incidents as well, but how all the different hospitals are operating, and in terms of quality and the risks that are involved in them. I sit on the quality and risk one. On a personal level, I chose to sit on the Gateshead quality and risk meeting with the CCG, just so I had a closer look at what was happening. And I thought, because originally I was elected and I was employed on the basis of being from Gateshead, that I thought the people from Gateshead would like me to sit in on that one. So I've always sat on that one, which has helped me as well to understand all the reports that come into the quality and risk meeting. I have to say that during all of this, we have been meeting online, and that, as everybody knows, makes it difficult. As you'll know from the meetings we have, it's so much easier, and you do catch up on a lot of information just talking to people informally. And you obviously don't tend to get that in things like this as such. So you do miss all of that, which I think is important. I think what we've done as lay members over this time is just try and ask the questions that we know lots of people would want to ask, and ask about things like, what did we do about homes, for instance, right at the start of crisis? What have we done about getting PPE for people? How have been helping the hospitals to try and keep on offering services? What are all the problems there, especially when we knew there used to be problems before that, for instance, in some of the hospitals? How are they managing? And so it's keeping on all asking those questions. All right, I've seen a question from Kate there. In terms of how long a lane member's elected for, I think potentially it was for 3 years at first. And what kept happening was the CCG kept changing. Initially, there were 3 CCGs, which all then eventually came together within one, which was Gateshead, and then the 2 Newcastle ones. We all joined together. And that kind of started another 3-year term. And then for some reason, there was another change. I forgot what that was. And we were ended up asking to stay there longer. So actually, it's been quite a long time. In that time, 2 people have left and 2 new people have started. One person stood for re-election and came back. That was Oliver. And the new person was Margaret Stewart, who people might know. Hopefully that's helpful. That gives you a quick overview. It's probably better if I start answering questions in that sense. So if there's any questions there about some of what I've been talking about, please ask. Do you think you have influence? On a good day, yes. Sometimes on a bad day, no. It's like all organizations. I think at times some things, I think some things you have influence. I think, for instance, if you think back to deciding together, there was a point whereby the Mental Health Trust was talking about moving Gateshead services to Sunderland, and a number of us raised the issues about that, and that eventually led to us stopping the trust effectively doing what they were thinking of doing and re-examining the whole thing, which is what led to Decide Together and God, I've forgotten it. So that made a big difference. I think sometimes you feel some issues are quite hard to progress. So things like inequalities at times feel quite hard to progress. But again, things vary from time to time. How do you become a lay member? Well, I think soon there will be some vacancies because the CCG was talking about re-advertising a lot of them. So it's once they advertise for them, an advert goes out and then people can apply then to become one. That may change, and Chris can say a bit more about this. I'm not sure if anything was said in the last meeting, but there is information that's come out from the government whereby they might be talking about changing the structure again, which might mean that CCGs will be changing or a new organisation may take over from them. A non-exec director and a lay member. I guess a lay member in one sense is that lay members aren't directors in that sense. I think is the best way to describe that. Kate, Nias, do you? Yeah. Oh, yes, I'm aware of that about Nias. Thank you. Are there any? Sorry, I'm being a bit scatterbrained there. Chris, do you want to say what the difference is between a non-executive director and a lay member?
The roles are very similar, Paul, to bring the dimension of somebody from the public to the governing body or the board. We just have use different titles in the CCG. For example, we don't have a chief executive, we have an accountable officer. So it's the same role that you fulfill that a non-exec director fulfills in one of the foundation trusts. It's just a statutory different title we use.
Oh, thanks for that, Chris. Kate, I used to chair engagement. Any plan to do that? Not any plans as such, but I did used to chair engagement in Gateshead, and then I chaired some of the engagement forums going on from that. I think when it changed, I'd kind of dropped that role for a while. But I do sit on the steering group and sometimes help to chair that. Any other questions there? You can stick your hand up if you want. I mean, I do need to emphasize, I think it's a very important role because it's kind of introducing people from outside the organization and trying to give that sense of, common sense approach and that different approach from just listening to people and being a member of the community. So I think that is important. And that's why it's important taking views from meetings like this as well. Yeah. Any other questions?
Before I bring
Lindsay, question hand there.
Before I bring Lindsay, Paul can add. Paul, it's Chris. Before I bring Lindsay in, can I just add some discussion? From a personal perspective, as the executive director, I certainly value the role of the lay members. It's important there, as Paul described there, they're almost critical friends. And they do offer challenge to the exec directors during meetings and ask really difficult questions, which is helpful to make us look and think about things in a different light, with different lens. So I do think the lay members are actually representatives of the public. And I know sometimes people say that's difficult because they do get a small payment, which members of the public sometimes think that changes the dynamics. But in actual fact, it doesn't in reality. And we've got some really sound lay members in Newcastle and Gateshead, 6 very articulate and well represented people who come from very different backgrounds, and they really do hold us to account, which is part of what their role is. So, as I say, I do value that particular role, and I would want to keep their membership. And anything we do going forward, any changes that might be to CCG just architecture. Lindsay, sorry, I was interrupting you. You've got your hand up.
That's fine. I was just going to say, obviously, enjoy your role, Paul. So, what do you enjoy the most?
Enjoy the most. Well, to be honest, I went into it thinking I came from a social work background where certainly in my early years, I was constantly fighting with people from health and to get people better served, really, especially in mental health, where I ended up specializing more, and often felt I was just fighting with health constantly. So when I went into this post, I thought I would be having to do a lot of fighting still. And I think what I've enjoyed most is seeing how much really good work goes on and actually seeing how people in health really want to keep improving services. And I think one of the things that's tried to help me to do is to encourage people to kind of make complaints and observations constantly to health, because actually they do change with them. So I've been really pleasantly surprised. And I think I enjoy just knowing so much about different things that are going on. I enjoy that. And I do enjoy, in fact, the interactions, because it's quite hard being a critical friend because you don't want to sound aggressive, but neither do you want to sound soft. So at times, as Chris says, we do ask some very searching questions. And the interactions are very enjoyable in that sense. Sorry, does that help?
Yes, thank you.
And I see Kate's asked some more questions there. Do you gather views through your own means and forums? Yeah, what I used to do, I don't have any other forums, although I did try and get to my own patient practice forum, which was difficult because it always clashed with something. But what I used to do was I used to try, when I was out and about, I used to try and talk to people and raise things and just chat to them. And then, funnily enough, I used to do it on bus journeys as well. I would use that because, you don't know who you're going to sit next to. So I just used to start conversations to hear what they were saying, etc., and get their views. So I used to try and take opportunities that I could to try and find out what people were thinking that perhaps I wouldn't normally see or come to contact with. And that was really useful. But of course, because of our present situation, a lot of that's not as good. And yes, Margaret asked some very searching questions. She's very good, actually, especially around things like serious incidents.
Margaret was the director in the former Strategic Health Authority, so it's very well versed and got a good background and what needs to be looked at and explored.
Yeah, she's very good, and I've learned a lot from Margaret as well.
Mm-hmm.
Oh, thank you, John. That's a good perspective. I think what we do miss is that, I think at some point we do need to get more kind of lay reps from different organizations just coming together. And that might be something we have to think about for the future, because I think that's another way of gathering information and bringing strength to that critical role. And we did try it at one point, but between things like the Foundation Trust and that, but that hasn't quite worked yet. But hopefully that will in the future.
Mm-hmm.
And that's something I guess we should think about, Chris, or your successor.
Yeah, we absolutely are thinking about that, Paul, how we join up what we do across health and social care, so not just the Foundation Trust, but the 2 local authorities we work with, and how we can communicate and listen to the public once, rather than each organisation going out asking similar questions. multiple times.
Yeah.
I would really love to strengthen the membership of this group and people who attend this meeting and have more people attending.
Any more hands
I'm
up or
mindful
questions?
it's now 10. I'm mindful it's now 10:02, Paul, so I was inclined to come back to the agenda. We're at the right time now. We've managed to keep the time right.
There is one hand
Unless
there, I
you've
think, Joanne. But yeah.
anything else pressing you want to say?
I think Joanne had a
Can't
hand.
see any hands up.
Joanne, did you want to ask a question? Because you did have your hand up, but I don't think it's...
Lindsay, it was just a quick comment. It was just to say, I think Paul's idea about bringing lay reps together where we do have them from different organisations and is an excellent idea, because if I think of the 4 lay reps within the Cancer Alliance, being able to speak to lay reps from CCGs or provider organisations to raise awareness of the issues for cancer in particular at a strategic level and how that filters down locally in the work they're involved in, and information coming back the other way, I think that would be really helpful. I mean, I speak on their behalf, but just what I know in terms of, their keenness to have influence at a local level as well as a strategic regional level as well. I think it's a really good idea. But I agree with Chris's point that obviously you've got your absolute focus on the CCG and what's happening, but even if it was just once or twice a year for those lay reps that would like to be involved, I suppose.
Brilliant, thank you. Comment from Kate.
Vaughan.
Can't read it because the screen's gone.
Back into the chat box. Have a look.
It's got a white square.
The chat box.
Thanks. I think that's me ended now.
So people are saying, it is Paul, thanks. People are saying similar things about wanting to join together some of the organisations to have those discussions, which I think is helpful. I mean, I am keen still for people from this to join this group and bring more representation into this group. I'm keen for general public people to come in, people from different backgrounds and people from different organisations. I just think the more we hear, the more effective we can be going forward. So
that would be very good, actually.
Yeah. Are there any general questions? Lindsay, there's a slide on my screen that says engagement dates for your diary. Is that the next slide?
Yeah, just for me to briefly mention this, I'll be sending out more information. I think I was going to contact groups like Elders Council, across Gateshead and Newcastle basically, but just to highlight on this forum today that we're working with Northumbria University, who are planning 2 sessions in February. They are 3 hours long, but they are informal, so you will be to just take breaks when you want. But we've worked with them for 4 years on this workforce competency development strategy. It's been rolled out across the region and people were involved in its development, but they need to evaluate the impact of that. So they're wanting to talk to older people to get their views on what outcomes we need to be looking at to measure that. So there's that one, and so that's the 9th of February, 9:30 or 12:30, online of course. And then we also have this one, which is again with Northumbria University. They've managed to get some funding to look at the frailty pathway of care. And what they want to do is look at the models of care out there, but what they would like to do is come up with one way of evaluating those pathways of care and find out what we need to think about to make sure that we have a standardized approach to developing these the evaluation. There's no like-for-like comparisons, if you like. So basically they would like to get a lot of engage with a lot of older people to find out what outcomes should be involved. I did say, is there going to be a bit of repetition between these engagement events, and that there isn't, obviously, because they're focused on different things, although they're trying to get the outcomes out of both. But there'll be more information coming in. If you would like to be involved, please email Hannah hannah.singleton@nhs.net, and then we can include you in the invites and send the link and everything for them. You can be involved in both, and you can be involved in one if one interests you more than the other. Thank you very much. That's it from me.
There's a question from Judy about what are older people and how old. From what I work with, generally when we're developing services, we use the age cut-off, and it's not always adhered to because it's often about need rather than chronological age that services need to be redeveloped. But we usually use the age of 65 based on that was the retirement age, and obviously that's more flexible now. It's moved up to 66 and likely to go longer. But that's age we consider people to be getting a wee bit older, if you like, so beyond working age. Are there any general questions anybody would like to ask before we bring things to a close? We've got 5 minutes left. Nothing? Nobody got a hand up? We're all happy? Can I also close again by asking is complete the evaluation is really important. So we make the meetings are valuable and you get something from the meetings. And we're very keen for you to expand and bring friends or tell us of people you'd like to add to our distribution list. I think that would be really important to us to get this grown, even further. We are exploring ways of involvement with the. Obviously, as you know, we've tried that before. We want to try it continuously. The practice participation groups are all very different, how they're constituted and how they meet and work. So we need to give a bit more thought how we're going to do that in a more effective way. So our next meeting is the 8th of February, 2 till 4 sitting at the courtesy, and a written summary will be sent out following the meeting, and the recording will be published on our website so people can watch and listen if they weren't able to join the meeting. Okay.
Thank you very much, everybody. That's great.
Okay, thank everybody. No forms of presentations. See you all in a month.
Yeah, thanks.
I'm sure I will with some of you.
Take care, everybody. Bye.
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 And thank you for that multiverse one. That was brilliant.